Today we're going to be doing our neuromuscular assessment. We can start by checking the cranial nerves. We can start with cranial nerve 1. Cranial nerve 1 is our olfactory, and we do that by checking our sense of smell. Close your eyes for me. Hold down one side of your nose. Tell me what you smell.
Alcohol.
Hold down the other side. Keep your eyes closed. Tell me what you smell now.
Vinegar.
Very good. And then we can move on to cranial nerves 2, 3, 4, and 6. This will check our vision. We check the corneal reflexes, the pupil constriction, and we can check our extraocular movement. We can check our pupil constriction by shining the light in the eye. Look straight ahead for me. We'll check our constriction there, and we can also check our movement. Watch my finger with your eyes. Move only your eyes. Very good. And then we can also check the patient's vision. If we had a Rosenbaum chart, we can hold that about 14 inches from the face and have the patient to read off the chart, and that way we can check the patient's actual vision. And we can also check the corneal reflexes. We just get a soft piece of cotton and we're gonna just briskly rub outside, and we look for the eyes to blink there to check the corneal reflexes. Then we move on to cranial nerve 5, which is a trigeminal. We can do that by using a gem clip and some cotton. Close your eyes for me. I want you to tell me when you feel a prick and when you feel something soft.
Prick. 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 Soft. 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 Prick. 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 Soft. Soft. Soft.
And we can also do that in the lower extremities as well. Very good. Then we will move on to cranial nerve number 7. Smile for me. Now frown. Puff your cheeks out. Wrinkle your forehead. Very good. Then we move on to cranial nerve number 8, which is our acoustic. We can do that with a whisper test. I'm going to cover this ear and whisper something on the other side and tell me what you hear.
99.
Do the same on the other side.
99.
Very good. Then we move on to cranial nerves 9 and 10. We can do that by checking the gag reflex. Also, we can check the uvula to see that it is midline. We can check to see if there's any hoarseness or any changes in the voice as well. Open your mouth for me. Say ah. Stick your tongue out. Ah. And the uvula is midline. Then we move on to cranial nerve 11. Shrug your shoulders for me. All right, now keep me from pressing them down. Very good. Then we can move on to cranial nerve 12. Stick your tongue out. Move it side to side. Very good. Tongue is also midline. And all the cranial nerves appear to be intact. Now we can check joint mobility. We'll just do this by bending joints. Ensure that we have flexibility in our joints. And we would ask the patient if they experience any pain when moving the joints. And we would do that throughout. And then we can go on to check our reflexes as well when we do a neuromuscular assessment. We do that with our reflex hammer. We can start with our bicep. We would do that by holding the arm out. We want the patient to be relaxed here. And we are going to press down on that bicep tendon, blunt side of the hammer. And what we're looking for is contraction of the bicep muscle. We can also check the tricep. Same way, have the patient to just relax, and we know that they're relaxed. We can dangle the arm here, and we will do the same. Put pressure on the tricep tendon and tap. And what we're looking for is contraction in the tricep. We can also check the brachial reflex. Here we would look in the side of the wrist here. And we can also check the brachial radialis reflex as well. I will let the patient hold my hand, and I would here on the inner wrist, and we see the fingers as they move inward. We can also check our patellar as well as our Achilles I'm gonna adjust my camera here just a little bit so we can get down and see those areas as well. For the for the patellar, we have our knee here. We want to relax that joint, and we see that go out. And for the Achilles, we would actually relax the foot in our hand. We would take the blunt side, and we see that reflex there as well. And we can also check for a Babinski reflex, where we would simply hold the foot up and we're going to scrape under that foot. And that